Happy Tuesday, everyone. I'm Lori, and you're watching the Beaver Bunch. This week, the topic is how do you tell your parents that you need to see a therapist? Well, it goes something like this. Mom, Dad, I need to see a therapist. Okay. I mean, that's really it. Because you can say how much or as little as you need to, but really it's just a matter of asking for some help. And there's nothing wrong with that. And I want to start off by saying in this video that I have seen a therapist. I'm not ashamed. It's helped me a lot. I know that when I was in the closet as a teenager, that probably would have been even more helpful than how I stayed ashamed and in the closet for a number of years and dealt with a lot of anxiety and a lot of, I'm sure, depression as a result. And but the idea is that you don't have to, and that you can actively work toward feeling better, getting help, getting support um, from somebody who is a professional. They are trained to do this. Depression, anxiety, whatever it is that so many people deal with is a clinical diagnosis. It's not made up. It's not, oh, you just have to buck up and like feel better, or why can't you just be happy? These are scientific processes in your brain that are caused by chemicals, and it's like, and I know Mary Beth says this a lot, and I love this analogy, and she says, if you were diabetic, you would take insulin. You need to even out your levels. It's crazy to think about people that let um, you know their diseases, their illnesses go untreated. But depression and anxiety is the same way. It's just in our society we have stigmas like, oh, it shows weakness to be depressed, or it shows what's wrong with you? Why can't you just figure it out, or whatever? And that is totally not the case. And you will find that when you see somebody and ask somebody for help, it's pretty well received. Like if you get to the point where you know that that's what you need, then that's a really good thing for you to realize about yourself, and the fact that you want it to be better and that you can foresee this as being an option or a solution. That's even better. It's so amazing. And I just want to stress that, like, specifically to our little community, the LGBTQ community is so much more affected by things like depression and anxiety and suicide and all these things, just because there is a whole lot less support from your families and from your friends, or from just your own closeting, or from added stressors, whatever. I don't know what it is, but that's, and bullying, and the society telling you that you're a marginalized citizen, and all these things add to self-esteem, self-image, self-worth. And for, unfortunately, there's enough problems with that in a like heterosexual, normal to society population, and then add in all these extra things, and it's like those are extra stress. So really, my whole thing is that I do this. I'm here as a happy face, as somebody who says, you got this, you're perfect already, because you are, for one, but two, because everyone tells you otherwise every single day, and three, there's so many people that are watching this, I know, that suffer with things like depression or anxiety, or who have been suicidal or whatever. And you guys, it's like, this is life, and it's so beautiful, and I want you to be in it. So that's why I'm here. In some roundabout way, that's kind of what it all gets back to. And so we can give you extra strength, extra courage, but you know what? We can only give you so much of a little push. Some of it is clinical. Some of it is an illness, and there's nothing wrong with that. It's just that you need to get it taken care of. Um, it's not like it can always just go away, and it's not like you can always just push through it, because sometimes you need extra help, and that is okay. And I just want to stress that it is okay. And the fact that you want to get help is great, and you just need to tell the right people. So your parents, if they're the ones that have the insurance, it is important that you talk to them about it, and you don't have to tell a lot to it. I'm sure that your parents would just trust that if you say that you need help, that they're like, well, okay. And maybe they'll be more in tune to you, or maybe they'll ask more questions, and that's a great thing. Maybe it'll open up a line of communication between you and your parents that you never had. But all in all, I think your parents love you so much, and even if they are not in your lives as much as they would like, or you would like, or maybe the other way around, I don't know. They want you to be healthy and they want you to be happy. So, you know, the fact, and I also want to stress too, if you go to a therapist and that doesn't work out and it's like, this doesn't work, go to a different one. Go to a different one because everyone is different and you need to click with whoever who is, you know, your therapist or your counselor or your psychiatrist or your psychologist, whatever. Um, so I just really want to stress that it is so important. Mental health is so important. You know, I'm a nurse, I'm in scrubs, I'm telling you, it's important. It's like taking care of your blood pressure. It's like taking care of your teeth. I don't know, it's like your brain is such a big part of how you interact with people and how you get through this life. So you need to give yourself the best chance that you can, and the way to do that is to take care of yourself. You know, if you need medication, it's not terrible. It's great. That's why they have medication. If you need therapy, that's awesome. Somebody will be there to listen to you in a very efficient way and can teach you new behaviors of thinking, and like, so the way that you think about things now might not be how you think about things after you've received help. So you need to just be hopeful and keep hoping that you'll be okay and that everything will be all right, and sometimes you just need a little extra help, and that's great, because you know what, we as human beings were not placed on this earth alone. We were placed with many, many humans with many, many strengths and skills, and you need to take advantage of those of others. So please, 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 I'm urging you, if you ever feel like it's too much or you can't take it, or like you are going to hurt yourself or someone else, or just to think about it, you know, it's already at a point where you should get help. And I have no problem saying that, because I think that there's nothing wrong with that. You need to get back on the right track, and there are so many tracks that you can get on and that are better than the one that you're on. So so please, please seek help, okay? Because you are loved more than you know, and even if you don't know, just know that you are, at least by me. So all right, well, I hope that you have a great week. I will see you next Tuesday. Bye.